Hi everybody, I'm very pleased to talk to Beth Westaway and Fiona Mutch today about their roles as clinical nurse specialists. Lots of people have asked for a session on how to become a clinical nurse specialist, so they've very kindly offered to give you some advice and tips. They both work at the Royal Marsden NHS Foundation Trust, and they're going to talk what they do on a day-to-day basis, what academic courses and professional qualifications they needed, and some top tips for any of you wanting to go into these roles. So let's go straight into the video and welcome Beth and Fiona. So welcome both of you.
Thank you.
Hi, thank you.
So my first question to Beth is, how long have you worked in your current role? And then tell us a bit about specifically what you do as a clinical nurse specialist.
So I've been in my current role for the last 10 months, so since January. What we do within the role is, so Fiona and I job share as the nurse specialists on the Man Van project. So we run the clinic on the van. So each day that we are on the van, patients will come to see us and we assess them. So we do their blood pressure, their height and weight, and have a discussion with them about any concerns they're having with their urology function. Obviously, I didn't specify, sorry, we're sort of urology clinical nurse specialists, might be helpful when we're discussing what we do. So yeah, we do a good, thorough urological assessment on them, so discussing any concerns they have with their urinary function, how they're finding that. And then we discuss any blood tests that they may be able to have with us on the van. So discuss the pros and cons of the blood tests. One of them is a prostate blood test, so we discuss that. And one of the other blood tests we offer is a diabetic blood test, so checking their sugar levels. So that sort of leads into a bit of lifestyle promotion. So obviously we're doing their blood pressure, their height and weight, offering these diabetic blood tests. So being up to date with the current guidelines, encouraging these men to go and exercise regularly, talking about their alcohol intake, etc., and just giving them advice that they can take home with them to implement in their daily lives.
So interesting. And so Fiona, do you want to give your perspective on that as well? Is there anything you can add to that?
Yeah, so I've worked also on the Man Van as a clinical nurse specialist for 10 months, but I have been a clinical nurse specialist in the urology diagnostic team for just shy of 3 years. I also do similar to Beth on the van. The days not on the van, we do results and telephone clinics. A lot of CNS does involve telephoning patients, so we will telephone with any abnormal readings. If that's their diabetic test, that's a good opportunity for us to do some further health promotion. However, if that is the prostate blood test, at that point we are referring them on a 2-week wait suspected cancer pathway. So that's quite a tough call to make, because a lot of men come into the van hoping there's not going to be a problem, and then you are telling them that they are going on what we call a suspected cancer pathway. So we would refer them on. So we do a lot of liaising with other trusts and consultants and GPs, so it involves a lot of communication. And we also, myself and Beth, attend the urology diagnostic clinic on the days that we're not on the van. So often we will refer men that we've seen internally to the Royal Marsden Hospital. So we get to see those men come in for their next assessments, which is really nice. It sort of lets you carry on in their care. And that involves sort of seeing them. They do some urine tests, they do some blood tests, we do physical assessment, they'll go for scans. We also attend sort of multi-disciplinary team meetings where we discuss scan results, biopsy results, etc. with the wider team, which is really interesting. So that's a good part of being a CNS, is you really do get involved with those sort of meetings where you can just learn so much.
And that's really helpful for people out there. And it sounds like you have a broad range of skills here. You're experienced nurses, you're autonomous, you need history taking, assessment skills, health promotion is a big theme that you were both talking about, and challenging conversations as well. So So if we talk a little bit about the courses and professional qualifications, because obviously you had a bit of experience before you started your role. So if I start with Beth, so anybody looking to do this role, what are the core academic courses, modules, professional qualifications or experience from your perspective? And you might want to talk through your journey a little bit as well.
Yeah, so I think definitely to become a nurse specialist, you have to sort of work your way up to that role. You don't just sort of go straight into it, because obviously there's quite a lot of different skills that you require to be in the role. So I had worked prior to coming into this position on a acute assessment units at the Royal Marsden. So that involved having to, assess patients clinically, both over the phone, because I had a hotline triaging service. So patients would call if they were unwell at home, and we'd have to triage them over the phone. To be able to get that role, we had to do a module to do that position. But that's very useful as we went through. We have a telephone clinic as part of our role as a nurse specialist. So you're calling patients, having these difficult conversations, sometimes, having to assess them over the phone. So having those skills has been really helpful, definitely going into this position. Courses, I had done the physical assessment course. So I started that course actually as I was applying for the role. So luckily could continue on that whilst I started. So what that course entails is you learn how to assess patients physically, so head to toe assessments, and they're very thorough. As well, a component is, a good history taking. So being able to get all of the information you need from patients, their past medical history, past surgical history, discussing their medicines, and any interactions with that. So that was really helpful. And I think definitely one of the prerequisites, I think, sometimes for nurse specialist roles that they kind of hope that people have done. It may not be fully required, but definitely helps with the position. And I am signed up to do the advanced communications module. So that's sort of where you go through more communication, being able to have those difficult conversations. So I'm looking forward to doing that. But definitely, even if you're looking at these positions and you have the opportunity to, sign on to a communications course, definitely that's very beneficial within this role.
And are they all, Beth, are they all level 7 masters modules, aren't they?
Yes, they can. Yeah.
Yeah. And are you being encouraged to join them together? Because I know in some trusts that they expect clinical nurse specialists to have a full master's or to be working towards, and you were obviously working towards, that was wonderful, and then they carried on supporting you. But it's not necessarily at the moment. I know the NMC are looking at regulating advanced practice, for example, and there'll be lots of changes probably in the future. But they're master's level modules. So a good tip really is to make sure you're on the right module that you don't do, because a lot of these modules for communication might be a degree level 6 or a level 7 master's. So you must check with universities which sort of level. And are you planning on doing your masters and joining them together, or are you just sort of taking it sort of as you go and just collecting the modules sort of thing?
Yeah, so once you've done one of them and the second one, I think you can decide at this point sort of if I want to merge them and do it on a master's pathway. So just discussing that and deciding, but most likely we'll probably go on to doing a master's at some point. So yeah, but you can link them together at a point. Yeah, definitely.
That's brilliant. So master's level modules really helpful, and you had some fantastic experience that aligned to the role. So moving to Fiona, do you want to sort of give us a bit of insight for your journey and what you
Yeah,
think you need for the role?
yeah, I qualified in 2015, so I have been nursing for 8 years. My first 3, 4 years were on a ward. Firstly, an orthopedic trauma ward, followed by a oncology ward. I then I then worked in the medical day unit, which is giving chemotherapy and IV infusions. So I was doing that at the Royal Marsden as a band 6 staff nurse for about 9 months, when I then became a senior staff nurse. And I was a senior staff nurse for about 2 years before I joined the urology diagnostic team. So I think being a senior staff nurse or taking on sort of additional experience was definitely helpful when going for a clinical nurse specialist role, because it's quite difficult to get a clinical nurse specialist role where they want experience if you haven't been a clinical nurse specialist before. But definitely you learn some transferable skills. I was managing people. I was speaking a lot with the sort of consultants, the treatment teams. So all that experience that was not as a clinical nurse specialist, you definitely can transfer those skills. Before being a CNS, I had done a sort of Band 6 leadership and development course, which was really good, and I was encouraged to do that. And that was just looking at sort of next steps and how to get into roles such as a clinical nurse specialist, a practice educator, these sort of roles and what skills are required. So that was a really interesting module. I went round and sort of reviewed places in a sort of CQC style visit, which was interesting to see. I've also done, similar to Beth, my physical assessment. I actually did that in the job, often as long as you are willing. That's one of the usually on the job descriptions, that you are either on a master's pathway, completed it, or willing to work towards. So I didn't have too many modules when I started. However, I have now done 3 level 7 modules, which is really good. And I, like Beth, I'm hoping to join them together and start getting my master's.
Brilliant. And I get a lot of questions, Fiona and Beth, about which modules to apply for, and then also which universities. And there's a lot of online universities. And so what sort of advice, I mean, the advice I give really is talk to clinical nurse specialists in the roles that you're aspiring to, and try and get some educator advice. But some people aren't working for large NHS trusts. So, I mean, where did you get advice for which modules to apply for?
I did speak, we do have a school at the Royal Marsden, so I did speak to those in the school about sort of what I wanted to achieve, but I also do look through and find the modules that do interest me. So
Yeah.
I really wanted to do my physical assessment and clinical reasoning, but prior to doing that as a level 7 module, I needed to have completed another level 7 module. So I had a look through and I did my acute cancer practice module, which was really interesting. It was looking at things that you do see regularly when working with cancer, patients with cancer, such as sort of sepsis. It was looking at spinal cord compression. So it was a really good broad module. So perhaps if you don't know exactly what you'd like to specialize in, having a good sort of general module that looks at a bit of everything is really helpful.
Like communication, physical assessment, and history taking is good, isn't it? Fiona, Beth, do you want to add to that at all, or?
Yeah, I think speaking to, like, friends and colleagues, people that have done courses as well, speaking to them and seeing what they enjoyed, what they got out of different courses as well, can sometimes help to guide you. Because then, because sometimes you read the description of courses and they're quite descriptive and broad, but just speaking to somebody that's actually done it, that can sometimes help as well.
Yeah. And if you don't work for a hospital trust, because that's where I get a lot of people contacting me, people like you are always really happy to talk to people about your job. Like today, you're doing it anyway. But you can talk to local universities. You can still contact large NHS trusts, probably, and community trusts have got probably the largest number of clinical nurse specialists, I would say, to the private sector. And people like you don't mind being contacted. So it's about sort of networking is so important. Don't be frightened to pick up that phone and email people and just ask them about their journey and for some advice. One thing I was going to ask as well, you're both urology clinical nurse specialist nurses. That's right, isn't it? Urology. And did you do cancer? Because I'm a neuro specialist nurse, not a clinical nurse specialist, but I specialised in neurosciences, and I did a neuroscience course. So I know any clinical nurse specialist has to do a post-registration neuroscience course. Did either of you have to do a cancer course or a urology course as part of a prerequisite for your clinical nurse specialist role?
Well, I think I'd worked within, like, the trust and worked in oncology for the last 3 years prior to coming into this role. And so I think because I similar, the same as Fiona, worked on like a medical day unit, so like a cancer care unit. So we had a lot of urology patients come through there, as well on the acute assessment unit, because they were all patients that were from the Marsden that had treatment. So we saw a lot of urology patients there. So a lot of patients that were coming to us after they'd had, route procedures and things like that. So sort of had a good sort of broad experience within oncology, not specifically urology prior to getting this. And so now sort of working towards all of that urology, sort of doing more research and modules around that. Yeah.
Right. So wasn't that so the prerequisites were quite broad really for the role that you applied for. And I think people applying will see differences across employers as well, won't they? That's the thing. Fiona, do you want to add to that, or was
absolutely.
there anything else?
Yeah, I would agree. I think I didn't do any particular urology course, but I had looked after lots of urology patients. So again, similar to what I was saying earlier, sometimes it's just transferable skills.
Yeah.
And I think if you're reading a sort of job description and it's something you're interested in applying, even if you don't have the exact experience, sometimes it's still worth going for and looking at what they're looking for and thinking about times you've maybe done something that's similar but maybe slightly different, and how, and if you can explain how you can transfer those skills. And I think as long as you show a passion that you're interested in, that you'd be willing to learn more, research, do modules, I think that's also so important.
Yeah, yeah. So have you got any top tips? So if I start with you, Beth, for anybody aspiring for this role, so you're a student nurse or an early career nurse, what are your top tips for somebody aspiring to do what you do?
Well, it sort of leads into what Fiona was saying. If you show that you're passionate about a role that you're interested in doing, one thing that I found very helpful was when I wanted to go for this role, I had reached out to the people that were on the interview panel prior to that, and I'm speaking with them, having a chat about what the role they wanted in the nurse that was going for the position. Shadowing is very helpful. And if you're not too sure about sort of what area you're wanting to go into, speaking with people, asking if you can shadow in some of the clinics in different areas, trying to sort of find that area that interests you is very helpful. And then you also have that networking. You get to know who's in those teams. Do you like that team? Is that what you're passionate about? And just looking into it a bit more.
Yeah,
It's
and
really
that's so,
helpful.
and I'm always encouraging anybody going for any interview really, especially at senior level, to do an informal visit. And they often say, "What's an informal visit?" And years ago, when I was a sister, it was sort of expected that you would go on an informal visit. You know, you contact the area, have a walk around, and get to know. And people are quite worried about contacting the interviewer and am I allowed to go? But what you're saying is informal visits are really important, and you can ask those key questions about the role. What are the key, what are the key focus for your role every day? What are the challenges, the barriers? And that can indicate some of the questions you might be asked at interview. What did you learn from your informal visit, Beth?
Well, it was good. I just got to learn because it's a sort of project. I got to discuss sort of what the project was looking at, what
Brilliant.
skills they were wanting. So that was really helpful. And then you also I had a face to I was going to be meeting in the interview as well. So I felt that actually quite calming. So that was quite good as well.
Brilliant. So fantastic advice from Beth there. So Fiona, what are your key tips for anybody aspiring to your role?
Yeah, I would agree. Before I was in the CNS role, I did spend time shadowing other CNSs for other tumour groups. I went along and sat whilst they listened to MDT. Even that was really helpful just to learn about conditions that I had sort of no experience in. So definitely shadowing where possible. And I would just encourage anyone to take up any opportunity that's offered to you. I started as a CNS in 2021 on a secondment role that I almost didn't apply for because I didn't think I had the experience. I applied for the secondment and actually was offered a totally different secondment role within the team, and it's now been almost 3 years and it's opened so many doors. So I think if I hadn't applied because I didn't think I had had the experience, then who knows what I would be doing now. But I think you always just need to take up any opportunities. When I was then offered a secondment that wasn't the one that I'd actually initially applied for, that was a whole new opportunity, something I didn't know much about in the diagnostic side because I'd very much always been at the treatment side of oncology. So I had so much to learn, but I think in the interview I showed that I was passionate, and actually again I didn't have the skills, but I had skills that were transferable. So
Yeah.
it's just important, I think, to take any opportunity that's offered, especially things like secondments are great because it gives you a good opportunity to trial something. If you don't like it, you can go back to your your original job, which is nice to fall back on. I didn't, and I'm still here 3 years later, but because I love it. But it's just good to take up any opportunities, because you don't know. I'm now on the man van, which is a whole new project from when I first started, so it may open lots of doors.
So what you're really showing as well is taking those opportunities in your current role. So you were, going and meeting the MDT and talking to people and finding, so it's all those transferable skills, because part of the role is about working with teams, and it's also aligning with your personal statement and answers when you give answers in interviews, that you're building up this bank of transferable skills that both of you have mentioned. So you're both proactive people, passionate to learn. That's something that's come across from both of you. And you're absolutely right, Fiona. It's about creating opportunities, not being shy and going for things like a secondment. And a secondment, for anybody that doesn't know, is a role that you can apply for. It's a fixed term, but you don't lose your current role. Usually you can go back to your current role. So you might do 6 months, I don't know, as a nursing charge nurse or something. Try it for 6 months, and then the opportunity might be that you can apply for the role, or it might be to cover somebody's mat leave or something like that. And then you go back to your role, but you've built up that bank of transferable skills. What did you learn from that secondment, Fiona? Just tell me a little bit about what you
Yeah,
learned and how
so
it was.
when I started the secondment, that was as a urology diagnostic clinical nurse specialist, a junior. Um, so it was a band 6 role, which I think was really great, because I had been really nervous to apply for any sort of clinical nurse specialist at band 7, similar, because I thought you needed to have a whole heap of experience in that specialty, which is really difficult to build up if you aren't a CNS. So again, it's looking at how you can get these things that you can put on your sort of personal statement that you can talk about in an interview without, if you've not been in the job role. Is it that you can attend a study day? Can you do, there's lots online. It's just looking at things that you can do. And sometimes, unfortunately, you have to do these things in your spare time. But all these things will help in the long run.
Okay, so thank you. Amazing tips from both of you. And we've also got a video where you're both talking about your roles on the man van, where you're going out into communities and promoting health and diagnosis, aren't you? So so do check that video out as well, which talks a little bit more in detail about your roles. So is there anything else either of you want to say? I don't want to hold you up much longer, but you've been amazing insights, and it's wonderful to hear about your experiences. But is there anything else either of you feel that you want to say to anyone out there? Or
No, I think it is just take any opportunity, and do just spend the time, if you can, shadowing teams. I think as a clinical nurse specialist, you do deal with the same things day in, day out. So it has to be an area that interests you. Otherwise, you won't want to carry on doing it. So spend time, find what interests you, so that you can make a well-informed decision.
Anything you want to say, Beth? Or
No, definitely agree with Fiona. Just any opportunities are there, just take them, and don't be too nervous or hold yourself back. Everybody's been where you've been before, so don't be daunted with, reaching out. We've all done it, we've all had to do it, and we'll probably continue doing that in the future. So we're all in the same boat and here to help each other. So don't find that holds you back.
I suppose one other thing I was going to ask, which I've forgotten, is you're so supportive of each other. And since I've got to know you, it's lovely to see that you've got each other. Now, some clinical nurse specialists, you've always got a team, but you might be the only clinical nurse specialist within a medical and allied health professional team. So have you got any advice about support and sort of how you get support?
Yeah, I think being a CNS, it's a lot about managing your caseload. So it's looking at how you manage your time efficiently. I know often, especially CNSs and on lots of job roles, people end up staying late and working through their lunch, and that can become quite unhealthy. So it's looking at what can you do in your time, how can you manage your time efficiently, and also if you don't have the time, who can you escalate that to? And you always should, I think, if your workload is unmanageable.
And if you're having difficult conversations, Beth, who would you go to? Like if you need to offload, have you got a support network?
Yeah, definitely. I mean, you had like your, senior nurses that you can go to. Fiona and I are quite lucky. We sort of have each other as a sort of team, but generally the CNS, is a team. We also work in an office with urology nurses from other sort of specialities within the urology team. So you've also got them that you can offload as well. So there's sort of lots of people that
Brilliant.
you can chat to. So it's quite a supportive network, really, which
Yeah.
is nice.
Yeah. And everyone doesn't know everything. So sometimes it just takes me and Beth talking things through, especially out in the community. We see lots of interesting men with interesting cases, and not everything is straightforward.
Yeah.
So sometimes it just involves talking things through, and then you can kind of come to a solution together.
Brilliant. Okay, well, some wonderful advice there. Thank you both so much. I won't keep you much longer now. So have a lovely day, both of you, and thank you. I'm sure everyone will really enjoy your insights.
Real no,
Thank
thank you for
you.
having us.
Yeah.